Hello and welcome to this special presentation of the ZS Prize. I am Vikas Dandekar, and as part of the ZS Prize initiative, I will be speaking to some of the leaders in the Indian healthcare industry. Our next guest is Ms. Kiran Mazumdar Shaw, Executive Chairperson of Biocon Limited. Coming to the set of questions on this ZS Prize and the entire concept that they have built. So I'll start from the few basic issues related to healthcare in the context of the entire scenario that is panning out. What, in your view, are the critical issues, challenges of healthcare and healthcare in India that are crying out for innovative solutions? Since you've actually spurred a lot of innovation startups on your own.
So, Vikas, if you think about healthcare in general, and then I'll focus on COVID in particular, healthcare in general, we've looked at the huge gap in terms of human capacity that we have in dealing with healthcare. We know that we are short of 2 million doctors, we are short of 4 million nurses, we are short of another 2 million paramedics, etc., etc. So the numbers keep increasing. Okay, we are short of X number of hospital beds. Our ratio of hospital beds to the population is also amongst the lowest in the world, etc., etc., etc. So I think access to healthcare is the first big challenge we have across the country. And secondly, we are also talking about affordable access to those who have access. So I think these are the two big challenges we have in our country. And I think when you look at what technology can do to bridge many of these gaps, I think we should really look at it seriously. So for instance, we know that telehealth is now a very effective means of reaching people who otherwise would not be able to reach doctors. Okay, so I think telehealth has a very important role to play. I believe that when you look at the disease continuum, I think we've focused a lot on treatment and outcomes rather than on preventive care. Okay, so how do we diagnose early and treat early? I think that's really another big opportunity we have to changing the healthcare model so that people have access to good healthcare and it's not going to be that expensive. Because what happens is as you sort of push the treatment to the last stage of the disease, it becomes more and more expensive. Now, when you look at COVID, I think we've realized that this has a huge challenge for us when it comes to deploying vaccines when they arrive, right? So if you look at what are the three critical issues or maybe four critical issues in vaccine deployment, the first is how do we use technology to deploy vaccines? The second is how do we create the logistics infrastructure to deploy the vaccines? The third is how do we create the human capacity to deploy the vaccines? And fourth, how do we enable equitable access to the vaccines when they arrive? So if you just look at these four elements of COVID vaccine deployment, I think therein lies the same story for healthcare in general.
This is for certain a jumbo-sized mobilization that will be required. And yeah, absolutely. So comprehensively set the ball rolling, ma'am. Next will be on digital technology, AI, big data as disruptors in the healthcare industry. Where we have reached so far and where do you think we can actually take this whole momentum forward?
So, because I think AI and digital, analytics is extremely important for healthcare in general, because biological data is big data. And we need to basically mine this big data very intelligently so that we can get predictive models of diagnosis and, treatment. Now, we know that even in a case of COVID, people were able to deploy AI to read CT scans and radiological data of chest x-rays, etc., to quickly ascertain whether this person has COVID and if so, how serious is the COVID. So this has been very vastly employed, and I think it was done so that it could be very fast. And I thought that was a very good use of AI in this particular, pandemic. But building on that, for interpreting X-rays and CT scans is something which you can go beyond COVID, right? So the Jameel Clinic and a scientist who's very well known, called Regina Barcelay, has actually started using AI very extensively in scans, in any imaging technology, in any image. So she's got imaging AI technology that she can use for either diagnosing cancer, diagnosing any kind of lung disease, diagnosing a lot of other kinds of diseases that go through radiological intervention. Okay. Mm-hmm. So I think this was a very good use of AI, which we can very easily adopt in a country like India. So, repurposing R&D data is extremely important. That's another very exciting idea, saying we do generate a lot of R&D data, and can we look at that data and repurpose that data for any new drug indication?
So well summed up, ma'am. In fact, talking about MIT, I was very interested in, when our scientists came up with Feluda, they had already done something that they called as Sherlock. Yeah, and they already had that emergency approval from the US FDA. So exciting things happening. I mean, this pandemic has really taken us to a realm of so many innovative solutions. Ma'am, briefly talking about frugal innovation and its implementation in the accessibility paradigm, and you touched upon the rural side of the story. Do you think there can be vast application of all these tools that we are having available, as you mentioned about the hospital data?
Because I really believe that affordable innovation should be the mantra around the world. It's not just about India. And when you talk about affordable innovation, there's a lot happening. For instance, that iBreast, that small, device that was developed by a small startup, it's a handheld mammogram with a high level of sensitivity, okay?
Yes.
And specificity. So I think this kind of device, which can be done for 50 rupees a mammogram, is the kind of affordable, frugal innovation that you're talking about.
Yes.
If you can use that in every one of our primary health centers in villages to basically make sure that it is a part of a routine checkup for a woman over the age of 30, I think that would make a big difference to diagnosing breast cancer, for instance.
True.
Okay. Then the same kind of innovation has been used in detecting oral cancers. Here you just use a mobile phone and take an image of the oral cavity, and through AI you can actually see whether it is a suspicious lesion or not, or a benign lesion. You can almost do the difference. And if it is a suspicious lesion, immediately you can do a biopsy in one of the nearest dental clinics and see whether it is benign or malignant. So those kind of things can be done very, very fast, and they can be done in terms of the early diagnosis that we're talking about. We know when you go to rural India with all their eating habits of pan chewing and tobacco chewing, that these are real problems. But if you can pick it up early, these people don't have to go through those horrible, fatal outcomes of oral cancers that they go through.
Absolutely.
So these are some of the interventions. So I really believe that innovation can play a big role in really improving our healthcare systems.
Ms. Kiran Mazumdar Shaw, thank you for talking to us. You're watching a special presentation of the ZS Prize. Watch this space for more.